Welcome back.
The World Health Organization estimates that there was a 25% increase in anxiety and depression disorders during the COVID-19 pandemic. A year or so after the outbreak, some people are still struggling to find ways to cope. Let's look at ways employers can support employees with their mental health. For this conversation, I'm joined by Magdaleen Scott, founder and managing director of KVD Communications. Magdaleen, appreciate your time this afternoon. So let's start off with how we can better support our employees' mental health, especially in the context of the rising prevalence of anxiety and depression post-COVID-19.
Yes, that is a very, very good point. And thank you for starting off with that and raising with that particular question. Sorry. I think the best way to explain it when you look at absenteeism and presenteeism, which is obviously two very different scenarios in terms of what employees are looking at and what they are facing on a day-to-day basis, would be to look at it from a perspective of how one can actually support them and what does that look like. And we used to say before COVID, or I want to say pre-COVID, and in the world that we lived in then, that there was a work-life balance that one had to have. So you would close your door or your office, or you'd walk out of your building, you'd go home and life would continue, and you'd be busy with the kids and the husband and the like. It's not the same anymore, and those lines are severely blurred. It's blurred to such an extent where we're seeing these increases, and where the brain drain is continuing, and people are resigning, and they're getting out of the situations that they've been forced in and placed in. And what we've noticed as a business is that there needs to be a collaboration and a cohesive collaboration where you find your work and your life and you collaborate the two, because they can't serve as different entities anymore. I understand this is a very strange sort of analogy and one to even find your sort of or wrap your mind around, and I get that. I really do. We deal with it daily. But it is true. People need different types of support in the situations that they're in right now. And it's fascinating and sad to see what is going on in the world of employers and employees and what they are facing, especially with the economic challenges that we have at the moment.
So Magdaleen, when we look at issues around, if we look at mental health, I mean, it sounds pretty self-explanatory that it is about the health of the mind. But let's talk about how the lack of sound mental health manifests itself, because I think that's then a key determinant of if you understand that there is a challenge with an employee's or employees' state of mental health, then you're likely to be able to react. But it's about identifying what those things would be then.
Yes, and that's where the work-life balance, collaboration and cohesively living together is kind of the sort of, I want to say, determinating factor here, if I'm making any sense. I want you to please clarify your question, though, if that's okay.
Sorry, you'd like me to re-ask the question?
Yes.
So when we take a look at employers, they have to have an understanding of the symptoms that show that a person is struggling with their mental health, because we don't ordinarily know that people are stressed or are struggling, particularly where human resource departments have not put in facilities that allow for that work-life balance, as you spoke about. Now, what are some of these symptoms that show that individuals are stressed and that individuals need some form of assistance? Because diagnosis, I'd imagine, is absolutely key in addressing some of the issues.
Yeah, I think, and this is the reality I think that a lot of corporates are sitting with, which is why people are, I think I want to say about 80% of the country are full-time back at work, like in situations like that, and where there's just not relationship anymore, you go. And I wish I can sit here and beat around the bush about this and give you a beautiful answer. And I wish I can sit here and tell you I'm a clinical psychologist and even give you those statistics by substantiating what I'm about to say. But unfortunately, I'm not either of those. I'm a business owner in a very, very difficult sphere within the South African business environment, as it is, well, globally, as it is right now. But I've been telling clients this from the start of this year, and I'm continuing to tell clients this because it doesn't feel like it lands. But at the moment where we're at, it's going back to basics. It's ring fencing what you have and going back to basics. And when you go back to basics, in our world, you go back, and from an HR practitioner's world, you go back to relationships. So unfortunately, relationships have broken down so much that everybody ticks boxes and gets through things. So with absenteeism, obviously the idea is that people just don't, they either just leave their jobs or they just don't go back, or they take long leaves of absence. We don't necessarily experience that in our business. We also don't experience pre-statism, which is where they just show up regardless of everything they face. They make so many mistakes that you almost need to hire a second or a third or a fourth person to correct all the mistakes because of the exhaustion stages that they move in. And there's two ways of addressing this. What we do in our business, which is, I don't think it's unique. I just don't think there's a terminology for it, which is, again, one of those things that, I'm going to shock you with, but is what I would like to call a relationship manager. So it's a person who literally has a relationship with someone, and they know in that line, it doesn't have to be your line manager or someone even within your team. It could be in different departments, but where they check in and go, look, are you okay? How are you coping? What is your day-to-day life looking like? How do you get through life at the moment? What is the problems out there that you're facing that we are not aware of? Or how can I help? Just the simple words. Do you need a lunch today? Is that going to be the thing that's going to help you? So finding these mentees or mentors within groups, or like I like to call them, relationship managers, is someone really going and saying, guys, I can do this. I can speak to someone about where they're at and the level that they're at, and I will meet them on that level, and it would be reciprocated. But it is not always the case with a lot of the things. And I mean, Hugo, again, as much as I would love to say to you that the world is rosy at the moment and it's beautiful, we are mothers. And we are fathers, and we are dealing with a plethora of elements being thrown at us in different ways that we're trying to navigate. And we want to be successful at our careers because we've worked hard at this. We got to a stage where we've worked hard at what we've built. We're passionate about what we do, and how that message relays and comes across is exceptionally important. And unfortunately, by especially the corporates, and as much as we support what they do and the work they do, and we want to help them to get there, it's also the people at the back of every business that you remember. Your last engagement with the last person is what you're going to take out of it. If they are in a day where they cannot cope with life, and it's impossible to show up for this meeting and look your best and act your best and say the right things at the right times and know the data off by heart, and have a sick baby at home that you just can't stop thinking about, or have a wife that's really struggling to get through life at the moment, which is most people's realities. This is the horrific part of this conversation. If this was one business's reality, or let's say two businesses, but it is most businesses, corporates, huge corporates, and small ones, and small businesses, and medium, everybody has a problem with this to some extent, of keeping the balance there and getting it through.
Sorry, Magdaleen, allow me to interject. We're running short of time, but I have to ask this before we wrap. A couple of things have happened since COVID-19, and one of those things is that the amount of stress that individuals are having to cope with has increased, because many people have been laid off, and situations at work have changed. But also with that, there's been a new model of hybrid working, where individuals are more flexible. In some instances, they go into the office maybe twice a week. The rest of the time they're working from home. Now, talk to us about the benefits of hybrid type of working, obviously amidst the goings on post-COVID.
Yes. So we have an agency with a fully hybrid model, which is one that I'm exceptionally passionate about, and I've seen the impact of it throughout. I think the nature of the business has changed, as you correctly said, and I so wish we had another 5 minutes to really unpack this, because it's beautiful. So the idea is that people are adults and they know where their priorities lie. The other reality is that you can time manage yourself. I don't need to time manage you because you are an adult and you know what is important and where you want to be. Plus, I also empower people, and I believe that you are the crafter of your own career. Where you want to go is what you dictate, and I don't dictate the journey for you. And I believe we're stepping into an age, which is what we're seeing in the industry right now, where people are saying, if you are going to dictate my journey and where my career is going, I'm just going to leave. And unfortunately, we need those skills in the businesses that we have, because again, it's the last resource you have with the current environment that you're dealing with. The positives towards hybrid working is insane. It is not for everybody. It is for very specific individuals that have very specific goals to aim. But the more life is integrated, and I don't know if this is I want to say it's a symptom of COVID that has brought all of this on, the more people have realized what is important and their priorities have shifted and how they want to reach that have shifted substantially. And I'm not the only one speaking about this, or if I am, it's sad. There should be more people speaking about this. The positive attributes that we found at an agency where you work from home full time and you really are the creator of your own time and where you want to spend it and how you want to spend it, insane. People show up even if they're sick. I have to force people. That's literally what we do. We force people to take leave. We remind them, if you're not well, don't work. I see you online. We've gone as far as locking people out of accounts because they continue to work, which sounds like a nightmare, but it's actually quite heartbreaking because you know this person really wants to and they want to try, but you also know they really need the time, even if they don't see it. Our roles have changed. It's not just about what is the bottom line anymore. It is what is about the person, what is in their character, and how do you feed those elements. And now you go and you say, in corporate South Africa, we can't do this. No corporate can look at people around them. But then you've got to be willing to enter an age where you lose the skill, you lose the experience, you know what you're losing, and you have peace about it. You cannot continue on the wavelength of wanting to treat adults like toddlers by forcing them to work in a specific way so that you can monitor every move and mostly justify, the spaces that you have and keeping all those balls in the air, which I don't necessarily want to trash. It's more the sadness of how employees are treated. When they really are capable of doing this from the word go, they've been capable of doing it and doing it correctly and doing it well. That is the sad bit about all of this. Keep the skills. People can take care of themselves. Not everybody is in that position where some want to be in office spaces. Most don't. They know where they're headed. They know what they're doing. Address the mental health illnesses. It's getting worse. Every week we read there's something new. It's because it's real. I don't think psychologists are sitting, behind the desk going, what can we come up with a new disease this month?
Magdaleen, I'm afraid we've run short of time, but appreciate you speaking to us. Magdaleen Scott, founder and managing director of KVD Communications.